So welcome to our family panel, a roundtable discussion of orthopedic surgeries. We have 4 panelists joining us who represent all 3 ASXL disorders, both with long perspective on surgeries that happened years ago, and some families who are more recently through surgery, so can speak about that perspective as well. So just a quick disclaimer, this session today is not here to provide medical advice. These are families just sharing their perspectives on their own experiences, and of course, encourage you to speak to your own medical providers about making any decisions for your family. So we're going to get started here. I'm going to ask each of the panelists to introduce themselves. So they'll share who they are, tell you a little bit about their child and which of the ASXL syndromes that they have and the surgeries that their family have experienced. And then we'll move into some broad questions. And for the folks who are on with us live, please feel free to ask questions as we go. So I'll ask Laura, who is also the chair and founder of our foundation and one of our panelists. I'll ask her to kick us off with introducing herself first.
Well, welcome everyone. My name is Laura Badmayev. My son Alex will be 11 this May. Alex has Borange-Opitz syndrome. In July of 2020, he had a dual Achilles extension surgery. And this past December, he had 11 orthopedic surgeries. Many of them I can't pronounce, but a lot of them are oriented around different tendons within his feet and lengthening and restructuring to straighten his feet.
Thank you. Teresa, could you go next?
Sure. Excuse me. My name is Teresa Locklear, and I have a son. Well, actually, he's our youngest of 3. He'll be 15 in May, and he was diagnosed back in 2016 with Shashipina syndrome. And in 2000, I believe it was 19, he had spinal fusion surgery. And then this past October, he had bunion and hammer toe surgery, and we'll be having the other foot done in April.
Thank you. Susan, could you go next?
Hello, my daughter Madison one now, and in 2014 she had both of her Achilles tendons lengthened and her arches reconstructed. There's a name for it, I'm not really sure how to pronounce it, like she said, and they put in donor bone rods in there and reconstructed her arches, and it was a 10-week process and then a lot longer recovery, but that's what she had done in 2014, and she has ASXL3 Bainbridge-Roper syndrome.
Thank you. And Rosemary?
Hi, my name is Rose. My daughter is Rosemary. We are from the Philadelphia area. She is 32. She has had spinal fusion at the age of about 12. She has also had bilateral subtalar fusion and hamstring lengthenings on both legs also. She has Boehringer-Opitz syndrome.
Thanks. So the first question is, how did you get to the point of needing these surgeries or deciding to have these surgeries? What were some of the issues that your children were facing? Were their abilities or mobility impacted? Was there a quality of life concern? What led you to ultimately choose to have surgery? So Rose, let's start with you.
Well, Rosemary, for spinal fusion, Rosemary had kyphosis and scoliosis, pretty severe by the time she was 11 or 12. And I think it was just time. She couldn't sit up. She couldn't hold her head up. She was actually straining to see straight ahead. She always had to bring her head up to see everything. So her organs were getting crushed. Her lungs were getting crushed. So it was definitely time for her. And the surgery went very well. And she did very well. The doctors, we went to AI DuPont. We saw Dr. Freeman Miller, and he actually advised us to when to do the surgery.
Teresa, can you share your experience with spinal fusion? What led you to choose that for Isaac?
Isaac, actually, about the age of 4, one of his physical therapists is the one that mentioned to me that she thought he had a little bit of a curve in his spine and that we might want to check it out with the doctor. So we checked it out with his pediatrician, and then that kind of led to being followed by an orthopedist. And because Isaac has grown so rapidly over the years, the orthopedist that we were seeing was not a pediatric orthopedist. And he actually wasn't comfortable following Isaac because he would have these growth spurts and he was concerned that something might be missed. So we ended up moving to a pediatric orthopedist, and he followed us for several years, and the curve just kind of was staying small, but then it started increasing. So we actually did nighttime bracing to see if we could keep it from progressing any further. But again, Isaac seems to grow very quickly, and he's a very large kid. He's currently 6'5" now and weighs about 313. And at the time, even when it started to increase, he was probably already about 5'8". And so they just felt like the brace wasn't able to, you know, do really what they hoped. And so ultimately the curve just kept getting larger. And so that was pretty much the option. He wasn't really at the point where it was affecting his organs yet, but you could definitely, you know, see the curvature. He was starting to be, you know, kind of humped over and whatnot. And so for us, the surgery went well. Probably, again, one of the hardest things through that surgery and any other surgery with Isaac is his size. So the people are used to small children, and Isaac is not that. So we often have to get special equipment, and sometimes it's hard because, you know, they can't find what they're supposed to, you know, have for him, even like a child's gown. You know, it doesn't fit him. So they have to go and try to find, you know, like an adult gown. So.
Thank you. Susan, you want to share your experience on what led you to choose surgery? Gonna have you unmute.
She's muted.
Yeah.
There
we go.
Madison started walking when she was about 5 and did well. They gave her some orthotics. She wasn't a fan of the orthotics, and we never could get them adjusted quite right where they wouldn't cause blistering in her feet because she had such thin skin on her feet. And she would just refuse to walk with the orthotics in her shoes. So she had lots of therapies, all physical therapy, occupational, everything. And when she was it was early in the year before she had turned 14, 13, she had a pretty good growth spurt there. She's really about 5'2", but she has long limbs. Her limbs are really long. And they thought, well, she was probably through growing enough to where they could do that surgery, because when she would get in therapy and stuff, any kind of shoe you put on her would cause blisters. She couldn't, because of the way the bones had fallen, and she was just walking on those bones, and you could almost see them come through her skin when she would get the blisters. It was just horrible. And I wanted her to be able to walk as long as she could and have that. So she went to Texas Scottish Rites, and they did the surgery in August, and we went through the surgery in 10 weeks. We had this for 6 weeks. We had the plaster of Paris casts that were really heavy on, and then they put some more casts on that were like walking casts. And then she came out. When she had those come off, she had the AFOs, and she wore those for almost a year, and she's been out of her AFOs since then. And she's not a big fan. She has them when she starts having issues, you know, with any kind of rubbing and stuff, but she's just not a fan of walking in the AFOs. She has a strong sense of self-preservation, and when it feels that uneven, not a big fan. So, but she's been able to walk without pain. I make sure we have really good shoes, and that really helps a whole lot, just, you know. And she went through all that, and she had great therapists, you know, and that helped a whole lot. So
thanks. Laura?
Sure. I mean, this occurred over, you know, many years. When Alex was younger, we started out with the foot orthotics. We had tried, different types of foot orthotics over the years. So his feet continued to like rotate and curve. And, eventually we transitioned into Botox and serial casting. So the Botox creates a block between the nerves and the muscles to help relax some of that tightness. And then they would cast his leg. We would go back after a couple weeks. They would cut off the cast. Then they would like move his foot a little bit more, recast, and you would do this over months at a time. We tried that for several years. Even some of the casts were up to his thighs. Eventually between the orthopedist and the orthotist realized we had kind of, reached our limit of any kind of progress there. It wasn't enough. And so then July of 2020, we did a dual Achilles extension surgery, which was supposed to last for 3 to 5 years. It ultimately lasted less than a year. Partly we lost like half of our nurses during COVID. There was a lot of transitions happening during that time with school, etc. And so then it was escalated to a specific group within orthopedics, Dr. Benjamin Schor at Boston Children's, who specializes in CP and children with neuromuscular disorders. And so in December, they did 11 different surgeries to completely recorrect his feet. We've never seen them so straight. But it was, I think, a pretty significant change for them to want to do this, because if we didn't do it now, we're losing that time to be able to make changes. Otherwise, his feet could have gotten so turned that they wouldn't have been able to do anything, and then that would have been a ripple effect into a lot of other medical issues.
So in hearing you sort of talk so far, we've heard a little bit about some of the recovery aspects, but would like to hear a little bit more about that. Would anyone like to share some of what you encountered in your child's recovery? Whether that was, therapies, if you needed additional equipment at home, if you needed additional hands to help you. Would anyone like to share about that?
Well, I would like to say, I didn't comment on Rosemary's ankle fusions. She was in cast for 6 weeks and it was successful, but I just wanted to mention to Laura that yes, her foot later down the road on her right did twist again, and I was advised to not go back and redo surgery. And it was partially because she wants her foot to go a certain way. She is pulling that foot on her own in a certain direction, and I can't stop her. Even in the mop though, she is trying to pull that foot in one direction all the time. Now I can get it back into a neutral position when I work with it or when the therapist works with it, but as soon as we're done, she pulls it right back into that twisted position. And I've seen 2 orthopedists in the past 2 years, and they've both told me do not do anything else to this foot unless she's going to do real functional walking. They wouldn't put her through another surgery. Now she's much older, she's 32, but again,
yeah, it's absolutely part of the challenge, right? Is surgery can alter the structure of your bones and tendons, but it's not going to change the signals from your brain.
Right.
They're telling your feet to go this way, right?
Yes.
And so, in addition, I should say, to the new foot orthotics with inserts that he has now, they also took his casts, sliced them down the side and put in padding and with straps. So we wear those at night. They want him to have casts on 23 hours a day. But I think for the other part of it, so for the month of April, we're going to be going to physical therapy intensive at the Napa Center. These facilities are all over the world, and they also do not just physical therapy, but all different types of therapy. So I'd highly recommend for folks to look into that and see, because my thought process is we need to also retrain his brain, that's sending these signals for the feet to move. The other thing that we're exploring for the summer is a Trexo robotics device, which mounts on the gait trainer. And so I think they were using the Rift and Pacer, and it's a computer system that like continually moves the feet to try to create that pattern, right? We've seen since, you know, we also increased his therapies to be doing physical therapy now for 3 hours a week, has made a difference. You know, for the first time, he's really doing well in assisted standing and moving. I will say that, you know, the recovery was brutal. I mean, I knew it was going to be difficult, but I didn't realize to what extent and how this also impacted other chronic medical issues. So Alex was in cast for 6 weeks. And when you have cast, you can't be weight bearing, and weight bearing is critical, you know, for like when you have GI and urinary issues. So he had started retaining pretty significantly while we're in the hospital, and they recommended for us to go home and begin catheterization. And then, you know, the day after Christmas, we're in the hospital. He had like 103 fever. His shirt was like soaked in sweat. We had to ultimately recast twice that week. He was in significant pain, crying and screaming, and very difficult to know, because I'm sure as many people have experienced, when your child is nonverbal and medically complex, it's like, what is the cause of their pain? There can be so many things, and you start running down all these different routes, running all kinds of tests, seeing all different specialists, trying to figure out what's going on. So that was heartbreaking, you know, feeling like, what could I do? So I think if I could advise anyone, if you're in a situation, I know there are quite a number of kids who have urinary retention issues, is once we started doing pelvic physical therapy, that significantly improved his results. As well as obviously once we're able to get the cast off and start weight bearing again. The other thing that's been incredibly helpful for us is osteopathic manipulation medicine, also known as OMM, which doctors of osteopathy, DOs, are trained in. Only a subset of them actually practice, but that has really been hugely helpful, as well with his sleep. So I think medications, you know, for a while we were on, he was on Oxy and Valium. The Valium really helped because there was a lot of spasticity after the surgery. So that really helped to kind of calm him and relieve the pain post-surgery, which they, you know, had initially didn't give us when we left the hospital. There was this miscommunication. So I think when we had the follow-up, that really helped. And then while in the hospital, I would say the Toradol helped as well with pain and the recovery.
Others have comments on the recovery period?
Madison's recovery was, only thing she didn't like was not being able to stand. It was rough. I mean, having to transfer her with the huge cast. I mean, she was small, so I could really pick her up. And I worked with elderly dementia patients at that time, so I was used to lifting stuff. But we had a Hoyer lift. I didn't really use it a whole lot because we didn't have enough room for it to actually be helpful. But the wheelchair they give you is a godsend, where it would extend all the way back. I could roll her to the shower and give her all that. It's really just her psyche of not being able to get up and move and have to stay in one place and not being able to move her legs because they were so heavy. Wearing the AFO, she did really well. It took her a little while to want to walk on her own. And then after we actually had the cast off, she had the best physical therapist that came in home. And her first time walking, we had to like take her AFOs off so she would actually want to move her feet and know that it was okay. And we just put her shoes on and she walked, and then we put her AFOs on and she realized I can do this with the AFO. So it was just really that whole thing. And like a lot of medications, like that stuff that would calm you down, it makes Madison bounce off the walls. So it was just, you know, we were kind of stuck between a rock and a hard place with that kind of thing. But she made it through. She did pretty good. It's probably as rough on parents as it is on on the child too, but it's worth it in the end.
I think Rosemary had pretty good recovery times. She was, there were tough recoveries on both her major surgeries, but I do think it's harder on me than her. And when she was young, she was very passive. She had a different personality when she was young. She's now at her 32, and she's has more anxiety and a little bit more impatient. She's not the passive child that she used to be. So she tolerated a lot more when she was younger.
I think Madison and Rosemary.
Yeah. And how old is she? 21?
21.
Yeah.
I say our recovery period was almost 3 months. I mean, in the beginning, we were waking up multiple times in the middle of the night to give him opioid medications. So there was some period of phasing that out. And then, I think it was about 6 weeks before we got the cast off. Once that happened, then there were significant improvements in the recovery time.
And what advice would you give to other families who are considering surgery? What else do you need to have in your home or in your life to really be ready for this, especially if you've, have other children or pets in your home? What are sort of the things that the doctors aren't going to tell you to be ready for? What advice would you give to other families who are preparing for a surgery to be ready for that maybe you didn't know going into this process?
I think you do need a lot of family support. Luckily for me, I have an amazing family, so I have a lot of family support. My friends in the neighborhood, they're great. They love Rosemary. She's been in the neighborhood most of her life. So I think that's very important. I mean, because you can get health. Rosemary got nursing care and health care and physical. They all came to the house in her recovery periods. And that's great too. Even someone to help bathe her, get her cleaned up. But there's other things that you need that a nurse doesn't give you.
Yeah, I think having a physical therapist who can come to your home, that was something they wrote a script for as I'm leaving the hospital. I'm glad we already have this organized, because that takes time to find someone and help. I think that made a big difference in the recovery. I think what else? I mean, I think having the, because there's also sometimes the behavioral aspect, right, of them wanting to kick and whatnot. And so having padding around the wheelchair in different areas, having different types of pillows and things to be able to elevate the feet and make them feel more comfortable, because there's just a lot of repositioning that you may have to do.
I think for us, one of the issues was we did have physical therapy after Isaac had spinal fusion, but the place that they sent us honestly wasn't that great with him. And so a lot of people look at Isaac, and because he is pretty high functioning, they look at him as like they do almost any other kid his age or older. But then when he doesn't understand what they want, or he doesn't want to do it because he thinks he's fine, that person, she really didn't even know how to work with him. And she pretty much said, well, if he doesn't want to do his work at home, then we should do therapy. And I'm like, well, you have a kid that does fusion, and yeah, he doesn't want this to do these or whatnot. So you need to figure out a way to motivate him, and try to help work that situation. But again, for us, Isaac has a pretty high tolerance to pain. So I have to say for him, that was very helpful with the surgeries, because when he had spinal fusion, he wasn't really in much pain. He actually said his foot surgery was more painful than his spinal fusion. But with the spinal fusion, it was getting comfortable is the issue that he had. And so because of his size, again, he was smaller, a couple of years ago. He's grown 5 inches, 6 inches since he had surgery. But it was being able to help him, to move him, because he also has anxiety. And so there was a very high amount of anxiety to do certain things. So even though I knew he could do it, he was just so fearful of doing those things. And the same thing, after foot surgery, like he didn't want to take a step. And I'm like, well, you did it at the hospital before they let us go, so I know you could do it. But then it was like he would be hanging on to me for fear of falling. Well, I'm 5'9" and he's, 6'5", and he outweighs me. And so he's hanging on to me, and I'm about to fall over, so that can make that difficult. So like I said, for us, which I know is not for everyone, the size really plays in big time, for us with equipment and care. And also, like I said, with the therapist, because we've actually had several therapists that I think were intimidated by his size. So like at one point in time, he had a therapist that was coming to the home and he was like 3. And she actually told me, I can't come to the home anymore because I'm afraid I'm going to get hurt. And I pretty much responded, well, then you shouldn't have chose this business, because that's what you do. You get down with the kids, you're helping them to do these things. So if you have somebody, if you're worried that you're going to get hurt, you know what I'm saying? I mean, then this might not be the business, for you. So that's kind of really played in for us, the size.
I think we can move to a couple of questions here. I know Ruth has one to kick us off. Ruth, would you like to ask your question? And maybe just as you start, if you just share a little bit about your family and the syndrome that is part of your life.
Sure. Samuel will be 24 in July. He was diagnosed. He was one of the first ones to be diagnosed in the UK. He was the 12th one diagnosed with ASXL3. He's had 15 surgeries altogether. The first one was when he was 4 months old, where not only his foot was twisted, but his leg was sort of bowed around as well. So he had that as a young baby. And then he's had lots of other sort of like tendon surgery and that sort of thing, like many of the others that we've been talking about today. Then it all seemed to be okay. It seemed to go well. But then in 2010, he was put in a red hot bath by a carer, and we ended up at the local burns unit. He had his feet quite badly burnt, and he didn't want to move after that. So before it, he was cruising around furniture, he was crawling, he was trying to stand up and walk on his own. But then he was diagnosed with PTSD because of it. He wouldn't go upstairs at all, so we had to have a room done downstairs for him. And then time went on, and it was about a year late, just under a year later, he had a Make-A-Wish holiday. So we went to Florida. He swam with the dolphins, and we visited all the Disney places out there, which was great. And then I noticed when he was a little younger, he used to go on a horse, and they had horse riding at the place where we were staying, but they couldn't get him on the horse. They couldn't open his legs enough to get him on the horse, which was really unusual. So sort of previous to that, they had said that he had postural scoliosis. So it was only that he was sitting awkwardly. It wasn't really bad. And that they would look at it again when he'd stopped growing to see if he needed any surgery. Mm-hmm. So anyway, this was a year after the accident. We were in Disney. He couldn't get on the horse. So when I came home, I contacted the orthopedic surgeon, and he said that the spine curvature had got a lot worse, and his hip joints were subluxated, and that he would need both surgeries done. We didn't really have a lot of support. This is my question is all around what support you got from therapists and stuff in the USA, because here it was kind of, they'd done the surgery, take him home, wait till he's better, and then he can go back to normal. There was no input from therapists and stuff. So he had his hip surgery, and he had to have both completely reconstructed. He had to have bone grafts, and they had to remold the socket. They had to take part of his femur away so it was in the right direction. They just had so much to do. And then when they did it, the right hand side didn't work, so they had to do it again. And that was only a couple of months after he had the original surgery. And so they put plates in to hold it all together, but we had no support at home about what to do and how to, and he was my only child, I'm a single parent working, and you know, it was so difficult. And then he was so skinny at the time that the plates were rubbing. So another couple of months later, he had to have the plates taken out. Then they said that he needed his spinal surgery. So he had full spine surgery done, 9 hours surgery. And he recovered from it really, really well. But during the recovery process, where we weren't getting any input from anybody, you know, I was saying, you know, what can we do? And everyone was like, well, he just needs to get better, you know. And then the hip surgery kind of failed, and his hips are now completely locked, so he can't open his legs at all. So he struggles to crawl, he can't walk at all, and it's very, very difficult to change him. He wears pads all the time. He's got no mental capacity, so he's quite sort of low down the scale, and so he doesn't understand. But it's difficult to even put a pad on him because you can't open his legs enough to be able to put the pad between his legs to put it on properly. And so I was just wondering what the support that you had was like, because I'm wondering if there's anything I could do now to help him get better from that. You know, is there any input, or is it too late to get input now? To, you know, all I really want is for him to be able to move his hips a little bit more, right, so that he can move around a little bit more and be more comfortable, because he's obviously in pain, because he will crawl a little bit, but he'll go like half a dozen paces and then he'll just roll over on his side. You know, that's, I've had enough, mum, that hurts. Right. And I mean, he's not very big, because he had his spinal surgery. He was only 12 when he had it done, so he still had quite a lot of growing to do, but because the spinal surgery, he didn't grow, so he's only about 4'11", and he weighs, I had to work it out in my calculator because I do stones here, stones and pounds, but he weighs about 51 kilos. So he's not big, but I have arthritis in my spine, so even at that weight, I find it difficult to move him. But it's just knowing a little bit about what therapy support you get, even now, even sort of like, not just after surgery, but years down the line. Do you still get lots of therapy support?
Anyone like to comment on surgery? Oh, yeah, go ahead, Laura.
I was going to ask, do you have pelvic physical therapists in the UK? So it's like a subspecialty within physical therapy, and they do a lot of movements and stretches with the hips that they can even do with him laying down, that I think would be really helpful for in multiple ways.
Yeah, he has just a physiotherapist that, I mean, he's at residential college at the moment, so he only comes home in the holidays, but they have a physiotherapist there that comes round a couple of times a week and just spends a few minutes with each student. Out of college, we do go to a specialist therapy centre, which is about 200 miles from where we live, but we can only go once a year, and I have to do fundraising, because even though it's a charity, they still do ask for payment, and I'm on quite a low wage, and it's sort of £350 plus accommodation every time we go. Right. So it's really expensive to do. They are better because they are they're not specifically pelvic physiotherapists, but they do spend more time with him, and they can teach me how to do things with him. But because of my own arthritis, I struggle with it. It's tough.
Yeah, I mean, because like we've been to all different types of physical therapists, but and we still do that also, but I feel like the pelvic physical therapists specifically have helped a lot with orthopedic surgery, as well as with urinary challenges. And then the other, like I said, which I'm not as familiar if they have doctors of osteopathy or if it's all MDs in the UK, but I know a lot of DO schools in the US, and they teach them, like I said, this osteopathic manipulation medicine, and a lot of it relates to like the joints and the tendons and the brain and how everything is synchronizing. I think those would be really helpful.
Yeah, if you don't get anything like that, but I mean, I can look into it, because there might be places in other parts of the country, you know, but I've not heard of us having anything like that.
Well, maybe if you look into your healthcare program, they might have a suggestion, or call them and say, you know, what are we eligible for?
Yeah, they just say like that there's a physiotherapist. If we need them anytime, we can give them a call for advice, and he can get enrolled in a hydrotherapy program. And that's all they'll offer at the moment, unless I pay for it.
The other specialty I would recommend who works in conjunction with our orthopedist is a physiatrist. I don't know if you have this spells, PHYSTRI, ST, the physiatrist. And so they can do things related to like Botox and different orthoses and other options related to like movement and the body. And they work with the orthopedist. And they're not, and as well as like the orthotist, but they may have other recommendations of things that you can do. Yeah, like maybe the Botox. I don't know if you've tried Botox.
He had Botox when he was younger, but it hasn't been offered since. And he did have like steroid injections in his hips, which was funny because I've had the same thing. But with the COVID and everything, we're looking at it's about 2.5 year waiting list now to be seen. Our waiting list is horrendous. I've been waiting to see a neurologist because I might have a condition myself, and I've been waiting for 15 months now to see the neurologist.
Has he had a bone density scan? Because that's another thing too that you know, like recently when we spoke to neurology, because there are a lot of children that have low bone density in the ASXL population, and you know, some of them result in like broken femurs or other challenges with their bones. As he mentioned that there are actually endocrine therapies that can be done, so the endocrinologist is another specialty you could approach and see maybe if there's anything they can do.
Yeah, I mean, I have bone density tests regularly myself because I've got osteoporosis, and so yeah, I hadn't thought about that. You're talking about orthotists. He did have that, and he does wear one AFO. He used to have two, but they said he only needs the one now. And what was the other thing you said?
Physiatrist.
Yeah.
Physiatrist, pelvic PT. And also osteopathic manipulation medicine.
Oh, the endocrinology. We did actually see an endocrinologist because we thought he had Cushing's disease. I don't know if you know about that. They thought he had that because he was so skinny, but now since puberty, he's just put on loads and loads of weight. And it was just suddenly, and he was having all these weird stretch marks under his arms and stuff, and somebody suggested Cushing's disease, but they did loads of tests and they said no, it's not. So he just needs to go on a diet.
Susan or Teresa, any suggestions from a therapy perspective, or sharing your own experiences?
We've never had any hip issues, so I'm not really sure. She's always been really flexible. Madison has been. The only tightness, she has some tightness in her hamstrings and stuff. We're hoping to avoid any kind of lengthening on that. She's still pretty mobile and is able to move, and she takes medications, like she takes gabapentin, and she has a muscle relaxer she takes at night time, so that helps with any kind of spasm she has. You know, it's usually at bedtime sleep where it's more pronounced because she's, you know, more still and not moving as much. But if we don't have that, then she'll kind of just lay there and kind of just pop her legs all night long, and you're like, okay, we gotta go to sleep. But she does have osteoporosis. We do the bone density stuff, so she takes D3 and calcium for that, and the D3 I think it helps a lot with like the pain and mobility, getting that into her, and it helps with mood also, because D3, even in us adults, you know, helps a lot in those when you're in a place where you get very little sunshine. So we all started that when we moved from Texas to Wisconsin. There was a lot less sunshine in Wisconsin than there is in Texas. So
it's like that all the time in the UK.
Yeah, I've been to the UK, so I know it's kind of cloudy and rainy there a lot. So
Yeah.
I
Yes, Samuel
wonder-
does have the Samuel does have the what you were saying about the gabapentin, and he has baclofen as well, and he does take the no, I take D3, but he doesn't. But I'll ask him about that.
Right.
Sorry,
I just
Kate.
was wondering if you had anybody that could maybe help you work with him, like to do stretches and things like that. If you had any family or friends that maybe would be able to help you do that, since it's hard for you to do that.
Well, the thing is, he has carers that come in. I have a really good team of carers, but
Okay.
again, that's funded through social care, and they will only allow me the hours support while I'm working myself.
Okay.
So it's,
Yeah, that makes it difficult.
yeah.
Yeah.
And I've got the my contract with my job actually comes to an end at the end of April.
Okay.
And I've got the opportunity to either leave or continue, but in another post. I work in mental health,
Okay.
and I'm really torn as to what to do, because I want to be able to spend the time with him and do things with him, but I also need to pay my mortgage and pay my bills, and
Right.
you know, it's really
Yeah, that's difficult.
big choices to make.
Mhm.
Yeah. So we're coming up to the end of our time, and just as a final question, just wanted to ask each of our panelists, would you do these surgeries again? If you had to go back, if you could go back in a time machine and make the choice to proceed with surgery or take a different path, would you take the path that you originally chose? So maybe Teresa, we'll start with you.
Absolutely. I would choose. Isaac reminds me all the time that it's not me that has had the surgery, it is him. So like today when I mentioned this panel, he said, well, none of you had the surgery, right? So why are they talking to you, you know? Because we were the caregivers and we took care of you while you were, you know, healing from the surgery. But, you know, but absolutely, because I do think that if we had not done the spinal fusion, I think we would have gotten to the point where it would have then been damaging his organs. So we kind of just hit it a little sooner than, you know, any other damage would occur. And with his feet, honestly, everybody has been shocked that he had that type of surgery at his age, but it had already been going on for a couple of years now. And it got to the point where, you know, whenever he wore shoes, you take his shoes off, you know, and his toes are all, you know, beat up and stuff. And he started complaining that it was hurting. And so that's when I said, well, Isaac doesn't usually complain that things hurt. So if he says that hurts, then it really, you know, must be bothering him. And so also because he has advanced, you know, bone age as well and everything, we think he might be to the end of growing, but it was just a chance that we had to take that, you know, hopefully it would work. But so far I'm happy and I feel like we made the right choice on all of them.
Thank you. Rose?
Yes, I feel the same way. I would definitely, absolutely do the spinal fusion again. And as far as the ankle surgery, it didn't do everything we thought it was going to do, but I would repeat it. Given when we did it, she was young and we were hopeful and we were trying something, and I would do them again. Now, Rosemary also has dislocated radial heads, bilateral in her elbows. We have never touched those. I don't know if any of your children have the same. She was born with that, but we were advised to never, ever correct it. So she doesn't straighten her arm completely, but her arms are functional. So yes, I would absolutely do the surgeries again.
Susan?
At the time, yes, it was a great surgery for Madison. If it got to a point, you know, because she would walk just a few paces and sit down, and I didn't want her to have to lose that mobility. I wanted her to be able to walk as long as she could, and I would definitely. And her feet, they have, you know, because hers didn't go out, hers rolled in, her ankles collapsed in on themselves. So if it got to that point to where her quality of life was, you know, it would take a little more soul searching to do it again. But if I knew if it was good for her, then, you know, I would probably do it again. Now, her being an adult, that is the only issue I have, because she's still small. like a child because she's only like 85 pounds and so she still has such childlike, her cognitive ability is probably 2 years old, in there. So, and with being nonverbal, going through adult doctors now, since we've had a transition to adult doctors, that is my only drawback is they don't have the same kind of care that we would see, it's not specialized. So that's the stopgap between, when you go from pediatric to adult and them not really dealing a lot with the special needs population. It's like you're in an unknown land when you become an adult, but we being in Wisconsin, we're in a really good system with the Frederick system, and she's a pediatric, but she does adult also. So she was a great, I got recommendations from a lot of parents when we first moved up there, and she's been a godsend. She's sent us to all the specialists, and they continued her care from Texas. So, thank goodness for the MyChart system. So it all transferred over. But that's my only thing. That's my only drawback of ever doing it again would be from going from pediatric to adults and having the confidence in the adult orthopedic system. So that would be my thing.
That's a whole nother roundtable discussion is when they do
this. To say.
I know somebody else dealing with that right now, and she said it's been a severe struggle. And I think about that because we're closer to that now, than we were when he was diagnosed. And back then I didn't really think about that kind of stuff. Yeah. But now I think more about how we will navigate that as it comes up.
Yeah. And you don't realize it's like when Rosemary turns 21, you don't realize how all of a sudden CHOP doesn't want to see you. Right. DuPont doesn't want to see you, and you're struggling to find doctors. I'm still struggling to find the right doctors. I mean, luckily I found an amazing primary care who I love, and she's very good with Rosemary. And I did find one neuro-orthopedic doctor that actually works at Children's Hospital and at University of Penn Medicine. So, and his name is escaping me, but if anybody wants it and you're in the Philadelphia area, I'll find it for you. But that's it. I can't find anyone. Yeah. I mean, to get her teeth done, I have to have her in the hospital. I have to put her under. I mean, it's just a struggle for every doctor.
Yeah.
And that's the struggle with the adult.
Yeah.
Luckily, St. Christopher's in Philadelphia will take Rosemary for certain things.
Okay.
And they're a children's hospital, and she's 32. They're just kind that way.
That's great.
So we'll add that to our list of topics for a future session. I think we have some panelists from this group. We could pop over to that one.
We'll get our list of doctors out and share them.
Yeah, exactly.
Absolutely.
So Laura, you want to round us out here with your, would you do it again as we wrap up here?
Yeah, I mean, I would say Alex got to the point where, we weren't going to be able to brace him. And, while he's not ambulatory, we were trying to do transfers, and just, I think being able to bear weight is so critical for sleep, for like urinary, GI, so many other aspects of your health. So I feel like from that long-term perspective, 100% it was worth it. It was really difficult. I'm not going to lie. It was a lot to go through, but if you're well supported and you power through it, in the end, I think the results are pretty miraculous, and getting the right surgeon.
Right.
Yeah. Well, thank you all very much for sharing your experiences and perspectives. We really appreciate it. And we'll have got the recording from this. We'll post it online for people to watch again in the future. So thank you for helping us create an enduring resource for other families who are considering surgery. So